Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Treating type 2 diabetes without medication isn't just possible, it's happening every single day. It's not a miracle, and it's certainly not something reserved for a lucky few. It's real, it's measurable, and for thousands of people, it's life-changing.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, type 2 diabetes nutrition specialist, Dr. Jedha.
Hello, wonderful people. Dr. Jedha here, and welcome to episode 97. If you've ever wondered, can I control my type 2 diabetes without medication? Do I have to take diabetes medication forever? Or if you've seen those viral headlines claiming someone cured their diabetes and thought, is that actually true? You're not alone. These are some of the most common and most misunderstood questions we get. So today we're cutting through the confusion and getting honest about what's really possible. We'll look at what the word cure actually means, what remission it really is, what the science shows, and how you can start asking better questions so you can write a better story for your health, one where you know it is more than possible to live with diabetes and without medication. First, let's address the elephant in the room right up front, the word cure. It's a word that gets thrown around a lot, especially online across the Wild West Web. You'll see headlines or videos claiming, "How I cured my diabetes," or "The one thing you need to cure type 2 diabetes forever." But here's the truth. There is no official medical cure for type 2 diabetes, and that's not just me saying that. That's the consensus across all the major diabetes organisations, medical standards, and research institutions. Once a person has a diagnosis, that diagnosis stands. But, and there's a big but here, just because we don't use the word cure doesn't mean we can't completely change the course of the condition. Many people can return their blood sugar levels to normal, maintain those levels long term, and live completely free of medications. That's not a cure in the technical sense, but in real life, it can feel a lot like one. The medical term, the correct medical term we use is remission. And remission means your A1C is in the normal range, below 6% for at least 3 to 6 months without the use of glucose-lowering medications. That's right, no meds, normal blood sugar, and ongoing stability. That's type 2 diabetes remission. So while we're not using the word cure, what we are talking about is very real, very achievable, and for many people completely life-changing. One of the most common questions we get is, do you have to take medication for life? And maybe you've wondered the same. The short answer is no, not necessarily, but that's not the message most people hear. What usually happens is this. You get diagnosed with type 2 diabetes, you're handed a prescription, maybe metformin, maybe something else, and you're told to come back in a few months. That's it. No talk of nutrition, no talk of reversing the condition, no clear roadmap, and no hope that you could ever stop taking the meds. Well, I'm here to tell you that's not the full story. There are thousands of people, many of whom I've had the privilege of working with directly, who've reduced or completely stopped their medications by changing their nutrition and lifestyle. We've had people go from insulin and multiple pills down to 0 meds, safely and with their doctor's support. It's absolutely possible. Let's take Dean, for example. When he joined the T2 diet program, he'd already been prescribed 2 different types of diabetes medications, but by changing what he ate and being consistent with his approach, his A1C dropped into the normal range, his doctor gradually reduced his medications and dosages, eventually down to no medication at all, and that's where he's stayed, because his blood sugar has remained stable. So no, you don't have to take medication for life, but you do have to do the work. A lot of people want a quick fix, but I'm not here to sell you promises. I'm here to tell you the truth. Think about how long it may have taken for your body to reach the stage you're at now. Probably years. For most people, it's not going to take years to turn things around, but to get off medications or avoid them, it does take a proactive approach. You need to follow a quality nutrition plan, monitor your numbers, and stay consistent. And ideally, you need to have a medical doctor who's willing to work with you, not against you. Unfortunately, that's not always the case. Some doctors are very conservative when it comes to medication. Some doctors are quite pushy even sometimes when it comes to medication. And even when A1C is normal, some doctors might keep you on meds out of habit or fear that things will backslide. But that's exactly why you need to be in the driver's seat. You need to know what your numbers mean. You need to feel confident asking, can we talk about reducing this medication, or is this still necessary if my A1C is stable? And you need to be willing to prove with your actions that you're serious about treating your diabetes at the source and through nutrition and lifestyle. Because at the end of the day, this isn't just about medication, it's about ownership of your health.
With Dr. Jedha's VIP online membership, you'll have proven, practical support to lower blood sugar, weight, and medication. Access detailed guides to understand exactly what to eat. Explore the huge members library. Browse thousands of easy, diabetes-friendly recipes. Use the health log to track your progress and improve your numbers. And join monthly member check-ins for personal feedback and trusted support whenever you need it. Join as a VIP member today. Visit type2diabetestalk.com/programs.
While personal stories are powerful, we always want to back them up with real evidence. So what does the research actually show when it comes to treating type 2 diabetes without medication? First, let's go back just a little. Not too long ago, it was widely believed, even in the medical community, that type 2 diabetes was progressive and irreversible. Once diagnosed, the thinking was you'd need to stay on medications forever, probably adding more and more over time. But that narrative is changing more and more as time goes on. In 2021, major diabetes organisations around the world, including the American Diabetes Association, Diabetes UK, Diabetes Canada, Diabetes Australia, and others, all formally acknowledge that type 2 diabetes remission is possible. That's a big shift, and it came about because of one key thing: evidence. Clinical trials have shown that diet and lifestyle changes, especially those focusing on lowering carbohydrate intake and improving metabolic health, can reduce A1C significantly, even more than medications in many cases. In fact, while most diabetes medications lower A1C by around 0.7 to 1.5%, people who make targeted dietary changes can see reductions of 2, 3, 4, even 5%. We also proved this in our T2 diet program clinical trial. Some people lowered A1C by as much as 3% in just 16 weeks, and 87% of program participants reduced their medication use. That's just in 16 weeks. I've seen it over and over again with our members over the past decade. People with A1C levels in the 9s or 10s can bring their numbers down to 6 or even below, just with food and lifestyle. That's not wishful thinking, that's evidence-based treatment. Now, I just want to add a caution here. For people with A1C levels up in the 10s or above, it's better to take a slower approach sometimes, as a sharp drop can increase the risk of retinopathy. That's issues with the eyes, and that's something to evaluate on an individual level. Now, here's where it gets even more interesting. There's a growing body of research on deprescribing, the process of reducing or stopping medications when they're no longer needed. Studies show that when people achieve an A1C of 7% or lower and maintain that level with nutrition and lifestyle, reducing or stopping medications usually doesn't result in their blood sugar rising again in most cases. In fact, many people stay just as stable without the pills. Even in older adults, deprescribing is effective and safe. One study of nursing home residents with an average age of 86 found that when diabetes medications were reduced or stopped, their A1C only slightly increased by about 0.3%, and there were no negative consequences. Another review found that 60 to 75% of people who stopped their meds stayed stable. So the takeaway here is this: when you eat to treat diabetes, which is what we help people do, medications often become unnecessary. And when your numbers are consistently in the normal range, deprescribing is not just possible, it's often recommended. But you won't hear that unless you dig deeper, and that's why this conversation matters. So let's flip the narrative. Here's something I want you to really sit with for a moment. What if the system, not you, is the problem? You see, in our current healthcare model, the moment you're diagnosed with type 2 diabetes, the default is almost always medication. There's no real pause, no proper education, no meaningful conversation about what else might be possible. The common pathway is diagnosis, prescription, and out the door you go. But here's the thing. That's not because medication is the only or the best solution. It's just the most familiar one. It's the path of least resistance. It's what's built into the system. It's the medical model, which is driven by Big Pharma and by medical doctors being primary care practitioners who are taught to prescribe and not much else. Medication can be useful and necessary for a time, yes, but the truth is, healing rarely starts with a prescription pad. So this is important. Medication first is not your only option. It's just the one most people are given. And that's where the narrative needs to change, because the story many people have been told is this: you have diabetes, it's progressive, you'll probably need more medication over time, you might eventually need insulin, you just have to manage it and hope for the best. That is not a helpful story, and more importantly, it's not true. The truth is we now have decades of data and thousands of real-life examples showing that type 2 diabetes doesn't have to be progressive. It can be improved. It can go into remission. And in many cases, it can be treated and managed completely naturally without medication. So the problem may be that you were never told this path even existed. Making a change starts with flipping the narrative. It starts with asking new questions. What if I can change the course of my diabetes? What if I don't need to rely on pills forever? What if my body is capable of more than I've been led to believe? Those are powerful questions, and once you start asking them, the story changes. You stop seeing yourself as a passive patient and start seeing yourself as the driver of your health. And believe me, no matter how long you've been living with diabetes, you have a lot of power in your hands to change things. Before we move on to cover some commonly asked questions, let's hear a testimonial from one of our members.
Vicky said, "I have gained an enormous amount of knowledge on how to handle diabetes. My husband is the one with diabetes, and I am the one who cooks for him. This website has been a great help to us as his A1C is lowering. I do also enjoy the recipes you offer and always read the library articles. Thanks again for all your help you have given us. You are the best site I have ever seen on diabetic care."
So I want to take a bit of time here to answer some of the most common questions we hear from people just like you, people who are motivated, curious, and maybe even a little skeptical. And that's okay. It's good to ask questions. It's good to think critically. That's how change begins. So let's cover some of these questions. Question 1. Can you live with diabetes without medication? Yes, you can. Thousands of people around the world are doing exactly that. And no, I'm not talking about people with perfect genetics or unlimited time and resources. I'm talking about real people, over 50, sometimes 60 or 70 plus, who've made nutrition and lifestyle changes and now have normal A1C levels without needing medications. It is absolutely possible. Question 2. Is it actually safe to stop taking medication? It can be, yes, but only when it's done the right way. If your blood sugar levels are stable, especially if your A1C is under 7%, research shows that reducing or stopping medications is not only safe, it's often recommended. We also know from experience that it is safe, with many of our members getting off medications. But here's the key. It needs to be done with your medical doctor's support, and it's usually a process. If you're taking one medication, your medical doctor will usually reduce dosages first before taking you off it. So if you're taking multiple medications, they usually reduce the dosage of one before stopping, then do the same with others. This isn't something you do on your own overnight. It can take a bit of time, but it is well worth the effort since every proactive step you take is only for your own benefit. Question 3, I'm on metformin. Can I ever stop taking it? Absolutely. Metformin is often the first medication people are prescribed, and it's also one of the easiest to come off. In fact, many of our members have stopped taking metformin entirely after improving their blood sugar through food and lifestyle changes. It happens all the time. Question 4. What if I'm already on insulin or multiple medications? Is it too late? No, it's not too late. The more medications you're on, the more important it is to approach things carefully, but it's still possible to reduce and even eliminate some of them. In fact, studies show that people on insulin or sulfonylureas, those meds that push more insulin into the bloodstream, may benefit most from deprescribing when A1C improves. It's about working step by step and monitoring how your body responds, having a good action plan, and working with your doctor as well with their support. But certainly, if you're already on insulin or taking multiple medications, it's certainly not too late to be proactive and try to reverse that pattern. Try to reduce the amount of medications you take or the number of medications you take. Whatever stage you're at right now, there is a path forward. You just need the right tools, the right support, and a belief that better is possible, because it is. Let's bring this all together. We started today with a big question. Can you cure diabetes naturally without medication? And while we know that cure isn't the right word, remission absolutely is. You can lower your A1C into the normal range, you can stop relying on medications, you can eat to treat type 2 diabetes and live a full, healthy, medication-free life. But only if you're given the chance. The sad reality is, most people aren't offered that chance. The system defaults to prescriptions. It doesn't stop to ask what you want. It doesn't show you what's possible with nutrition and lifestyle. That's why this conversation matters so much, because when you flip the narrative and start asking different questions, you begin to see a different future for yourself, one where you're in charge of your health, not your prescription list. That's an incredibly empowering position to be in. Before change can start, you have to believe it's possible. I can tell you from experience and science, it is. Life can be different for you when you get proactive with small, consistent steps each day. If this episode has sparked something in you, maybe a sense of hope or even a bit of fire, I encourage you to take that next step. Start exploring what's possible. Revisit some of the other episodes I've mentioned, or if you're ready for a proven plan and real support to help you do this, check out the programs and resources we offer at type2diabetestalk.com/programs. That's all from me today. Until next time, stay hopeful, get proactive, and remember, you have more power over your health than you might have been told. Dr. Jedha, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.